You can start, sir.
Both. They are homeopathic elite members. We invite you for another session of discussions. I have seen in many Google meetings where they can do these homeopathic lectures and discussions. Many of them join. Because they have interest in that subject. Unless you create interest, you cannot feel encouraged to follow this system of medicine. What I am trying to show is, you have to create self-interest. Supposing you are watching a show in TV, OTT or TV, whichever part you like it, you may see it. Other things you ignore. For example, dance, for example, discussions, etc. Or somebody may like only discussions, not the other subjects. Homeopathy is not like that. You have to go through the entire system. And it is not easy to understand by a common man. Because he must have some basic knowledge. We are all shown so much of it as so many days. We are developing yourself now by practicing and by helping others. But now you must equip yourself, enrich yourself. Yes. Hereafter, our subjects will be mostly general, because we give given the basics, philosophy, approach to homeopathy, fundamentals of homeopathy. All these things have been well equipped now. That is why we are not repeating that time and again. If I say only that, you will be bored. Supposing I again go to Hahnemann's philosophy and begin to explain the aphorism, will close the WhatsApp. That's why we are giving you now more and more clues to understand the situations of the people. Yes, it is one such observation. When taking homeopathic medicine by a patient or by you are giving it to a patient, you must ask him what all the medicines he is taking. For example, he is saying that he is taking medicine for blood pressure. You cannot ask him to stop it. Stop. You must ask him when he is taking it, and then we must give the potency accordingly so that our medicine will not be disturbed. So, generally, the patient should abstain from taking any other medicine except homeopathy. That is a fundamental rule followed by Hahnemann and his successor. Is it possible today? Absolutely not. You cannot ask a person to stop taking medicine for blood pressure. Then he is running to coma and other problems. And they will say, family members, goodbye to family. So, we have to make our system of medicine work in such a way under different circumstances. It must travel into the. That is why time and again we give you the tools and other things. Supposing he is coming from another disease, or he is your own patient coming after a long time. You must again question him. Yes, you already questioned all these things to him. He is an old patient. Like that you cannot ignore because habitats change time and again by the human beings. From total way of food taking or methods of adoption of different strategies by the patient, all concepts will change. And further, is a cancer patient, person who uses perfumes, liniments, who used to apply goggles, face washing, mouth gargling, all these things will seriously interfere with our action of the gland. We cannot ask him to stop medicine for blood pressure, but we can ask him to postpone all these external applications, perfumes, gargling, etc. Because man started his career with the high living. When high living is there, to interfere with medicine is a difficult process. You will not get the desired or expected results. Then what to slowly teach him to stop smoking, he must stop his drinking, he should not take tobacco,
ನೀವು ಹೊರಗಿನ ಕ್ಲಾಸ್ಗೆ ಅನುಪಿ ಲಡ್ಕಾರ
try to recall his space.
ಸರಿ ಓಕೆ ಓಕೆ ಓಕೆ
Tobacco user, continuous smokers, wine drinkers, it's very difficult to handle such person. have to give medicine according so that the recovery must be there. If there is no slightest recovery, he will run away from you. You must show that is your ability, capacity, and no doubt, slowly he will respond to things. In such cases, it will take a lot of time to cure the patient completely because of his high standard of living. Yes. This is a preliminary. Then comes helping our medicines. We give Naxamika or Ipecac for indigestion and nausea. These are not commonly indicated for acute everyday upset stomachs. There is a stomach upset every day. However, these two remedies are different spheres of action. Naxamika and Ipecac are got different spheres of action. Ipecac has affinity to pneumogastric nerve. So, it's a keynote for nausea. Even the patient vomits, but his nausea doesn't control. Whereas Naxamika has an affinity to the nerve. Producing stomach, spasm in the stomach. But it is also a big affinity for liver. Naxamika is relieved by vomiting. Ipecac, you vomit, you are relieved. Naxamika, you vomit, that's a relief. But these are the keynote things. You have to use it judiciously according to the circumstances of the each case. Then comes Synphytin. You all know, several times you have heard important bone remedy in the homeopathic material liquor. No wonder it's the first line for most skeletal protocols. Otherwise, injury to the bones, bone degradation like arthritis, broken bones, fracture or pain, and also to promote healing, all right, sometimes any procedures involving bone extraction, that is, tooth extraction, causes vacuum. You feel like touching it. There, symphytum bugs. We give symphytum after the operation also. After the tooth implant also. Bone surgery, bone replacement, or any fall causing pain in the area does not respond to soft tissue surgery. Here are the possibilities of exercise continues. Why I am telling you this? When you are young, you hit something. After 1 hour, 2 hours, the pain is gone. Whereas in old age, when anything you hit, either the muscles, tissues, bone, nerve, they get pain. That's lot for a day, 2, 3 like that. So symphytum along with arnica, when no losing of blood is there, open wound is there, no open wound is there. Symphytum along with arnica. If the bone pain continues after some time, root also can be done. These are all the things that homeopathic mind should observe, these fundamentals. Even for this, he should not look into the book. That is why we are repeating you time and again to know about this fully and thoroughly. When we teach something, express something, and immediately you try to read once by the night, it will be very clear in your image, mind. You will not forget. I used to give some
సినిమా చూసుకో
simple
ఏమో దృష్టి
మైనస్ దాంట్లో పెట్టి ఈ చివరి దాంట్లో పెట్టి
తర్వాత మైనస్ కొట్టేసి ఇది మీరు ఎలా స్టాప్
Sign
కొట్టేస్తారు
yeah.
ఈ PPT లో స్టాప్ కొట్టేస్తారు
real means
అది అక్కడ
Right.
ఇంట్లో ప్రింట్ చేయదు Just
Sign
కొట్టేస్తారు.
name.
ఇది స్టాప్
What
కొట్టేస్తారు
for? Right
స్టాప్
side.
కొట్టేసరికి
Yeah.
అది పాజ్ స్టాప్ ఏదో ఒకటి కొట్టేస్తారు
Right deal here.
మైనస్ చేసుకో సినిమా రికార్డ్
Real means
క్లాస్ చేయకుండా చేశారంటే సినిమా కూడా రికార్డ్ అవుతుంది
So for all the problems of the left side, by the left, along with the indicated other. That's how we must keep our mind again knowing the homeopathic approach. Yes. Ambra Asia. Young have known about this. It is for those person who are highly sensitive, socially anxious, easily overwhelmed, etc. Mental weakness and forgetfulness, difficulty in concentrating, mind goes blank in social situations. Social anxiety and nervousness, fear of embarrassment, discomfort while you are in the company. You feel discomfiture. Blushing easily emotion suppression. That is emotion suppression. Greed. All these things are bottled up. That is suppressed means you put them into the body. You don't express it out. Sadness. Withdrawal from others. I want to go. Your friend said, hey, please sit. बैठे ही है हम तो तीन महीने के बाद बीत गया है क्यों हंसता है don't go that you enjoy yourself but he feels very difficult in the company. This is the Amparagracia situation. Nervous exhaustion. What all I said earlier is mental problems. That is mind, related to mind. Likes and dislikes, etc. Nervous exhaustion. Overthinking, easily drained, and trouble sleeping from worry. Overthink. See, my dear businessman, he is a corporate CEO. Corporate CEOs nowadays don't trouble themselves. They are not important people. They have assigned the task, then discuss it then. So, they will not do it because they go through all the social aspects. Without thinking, they cannot maintain themselves. Easily drained, that is, they become exhausted. They always have troubles during sleep. Why? Because of the work. You see, they run in the WhatsApp. I don't know how they lose lakhs and lakhs of rupees. Then they hang themselves. This is it. Always having troubles because there are activities. A drinker, if you control him, he will have aggressiveness. Like that, a gambler or anybody who play for things, they cannot be curtailed unless they turn themselves. There are many methods to control them, to distract them. But even then, controlling of the mind, they must themselves learn. Homeopathic medicine is given. It goes and works. It relieves your moderation. Then what comes? Your vital force comes out. Then can it take control? Similarly, for drinkers, for gamblers, etc., fast goers, you may give medicines and pacify them and control them. But they must develop the discipline. Without that, you cannot. I have seen umpty number of people, even my friends, many of them, they are addicted. They are gone to this Sneha, something that some helping institutions where they have been advised and philosophically everything is done, asked not to take drinks. Then what happens? After coming away from the institution, 1 week or 5 days or 1 week they sleep, then immediately something instigates the cold death. We cannot care the self-control must be developed by it. They waited for 3 days or 4 days. We must wait for another 3 or 4 days. Like that 1 week, 2 weeks, like that 1 month, 2 months. Then we will be complete. Because the alcohol in the blood, the tobacco in the blood instigates you to go to that. Instigate the brain to go to that again. Overthinking, easily brain, troubles during sleeping due to worry. Then comes digestive disturbance because anxiety, bloating of stomach, indigestion and constipation worsened by stress. Completely understand this. Each word has got deep meaning. Disturbances from anxiety. We already said earlier, sleeping worries. That is during sleep. Here, stomach plays a part. During anxieties, stomach secretes acids. Mind gives signal. Mind is the cause. It gives signal to the stomach. Stomach secretes. So that irritates. So, disturbances take place in the stomach. If this continuous anxiety is there, stomach can completely goes out of bloating of the stomach, indigestion, constipation, worsened by stress. Why does stress take place? Because of the worries, because of the activities, because he is not able to forget them, etc., etc., etc. So these are the things that brood over the digestive disturbances. One more thing. When constipation takes place, it also gives disturbances to the digestion. So circle continues. Get the stomach, small intestine, larger intestine, everything gets problematic. They are functionally okay, but they are disturbed emotion because of your mental nature, mind having thrown its stress on the stomach. Why? Because worries, problems. See, the family head is there. He gets continuous disturbances. One is money, disturbances in the family, fighting within the family members, etc. All these things cannot make a right thinking enter the family from overcoming the problem. If he is not able to overcome this, all these disturbances come. He is able to overcome by virtue of his ability, capability. That is why our Hindu philosophy, yoga, meditation, gives enormous strength to the mind, gives self-confidence. Then you can overcome all this. See how mind is interrelated here. Even the medicine is also interrelated. The more the medicine takes place, the more worry comes in, no help. Everything must be. That is why even the allopathic system, they go into your nature, background, they analyze yours, they give necessary briefings and people. For example, heart patient, heart attack, he is giving lot of advice. How she should, because they want to know what is your worry, are you suffering from any other problems? I am telling you again and again, one must have a perfect living. No doubt, we all have class 60s and above. Without perfect living, we would not have come up to this level, would have succumbed to that. But we should not keep ourselves, we must keep the family members, children, from maintaining some good habits, etc. Like taking food in time, going to sleep at a proper time, getting up at a early time, doing some sort of exercises. Suppose he is a person who is always working in a factory, he did not have another exercise. I used to say, when Appa put in I meet in the court hall, so we don't keep quiet. Morning, early morning, because we are walking in the courts from one floor to another, one hall to another, etc. He used to laugh at me. He used to say that whenever I don't have work in the court hall, I will go to walk, etc. So that was memorable days. Many may come, many may go. One has to go on fine. You have to keep on in your life always, because somebody has defaulted. You should not get wrecked up, broken up, and then you also go into the fault. As you see in cinemas, when no stress comes, his friends suggest his let's go for drink, you will forget everything. So these are the fundamentals one has to follow, one has to make his family members, his friends keep that thing from. But when you know that he is a person who cannot follow you, refrain from doing all those things. Why are you telling him? This will all lead to disturbances in your health, day-to-day activities. You cannot recover from all this. You will succumb to all this. A chronic diabetes, you don't want to go to. Any of the method of medicine, you want to go only to one center of medicine, where they drug in. I think you understood some basics. Next session, I go to 2 or 3 remedies, and then I will give the differences, then how and why each has to be taken. But handing over to me.
Is my voice audible? Hello?
Yes, yes.
Okay, thank you, sir. Namaste, my dear homeopaths. Thank you, Surendra Garu. Instead of taking regularly homeopathy course only, that's also, it seems boring to everybody. So from next class onwards, I will take on mind. So we will have general discussions and medicines also. Because why I am telling this one, if mind is in your control, that is in our control. If the mind is in our control, then our body health will be in our control. Otherwise, if mind is not in our control, the body health will be in the doctor's control. Whichever we want, we have to select. So better to keep our mind calm going. Whatever you are doing, morning exercise or walkings or whatever it may be, everything is to get mind calm. But nobody is calm now. So today I want to take certain aversions. Generally we will have some aversions. Previously before 40 years or 50 years, whatever is available in the house we are eating. And the hotel also, whatever is available, very 8 items or 10 items. Out of that 8 items or 10 items we are eating. Nowadays if you go to a hotel also, they will give a menu card which is having nearly 10 to 12 pages, which will confuse you, and what you want you will not take, you will take some other thing and everything will spoil. Mind will spoil and body will also spoil. Certain aversions will come from that time, that only. So now aversion means strong dislike or discrimination. Suppose Abies candidiasis, we have taken this medicine, Abies candidiasis, abnormal appetite will be there. These people will have aversion to pickles. Abies candidiasis, aversion to pickles. But they will have abnormal appetite, going on eating beyond their normal intake. Aconite, aversion to music. Because always they will be in tension, fearful, anxiety. They can't tolerate music. Music make them sad. The same thing we are having in graphitis also. If anybody keeps in my house more sound of a music, immediately certain people will tell stop it, stop it, stop it. So aversion to music means you will have first and fundamental remedies, aconite. Next, just now our Surendra sir has told, Ambragracia is one of the very good medicine. Slowly, because of our age, say about 50 years, 60 years, 70 years, because of our age, everything will be reduced in our body. Slowly we may forget so many things and unable to walk continuously, unable to talk continuously. At that time, because of the age criteria, if anything going down, and the persons also, they will be wants to be alone. They don't want to mingle or mix with people. Those people require amberglacia. These people generally, if anybody laughs abnormally, they can't tolerate. Aversion of laughing and abnormal aversion to that. Next, ammonium chloride, aversion to water. They cannot bear the touch of the water. The same thing we are having with sulfur also. Sulfur, he will not go to washroom to take bath. Bath itself is aversion to sulfur. Like that, ammonium chloride, aversion to water. Ammonium moon, pick and choose personalities. Ammonium moon people are pick and choose personality. If 10 to 15 people are there in school or college or any meeting, they will select only 3 or 4 people. With them only they will talk. The remaining people they don't want. Even they side the face also. For that, ammonium moon, aversion to some particular persons. Antimonium tartaricum, aversion to milk. And moreover, milk aggravates the person's means antimonium tartaricum. So antimonium tartaricum, aversion to milk. If he takes milk forcefully, he will have nausea. So antimtar, aversion to milk. Even if he takes also, nausea will come, otherwise phlegm will come out. Argentum metallicum, aversion to work. Whatever he has done, that is sufficient. More than that he will not do. Aversion to work. He is not workaholic. Moreover, you can take argentum metallicum. They are not workaholics. Arsenicum album. Generally we know everything. Aversion to cold drinks. Always good for arsenic album. Because of cold drinks only we are getting so many problems. So aversion to cold drinks means you can give this one. Beritacar, aversion to banana. You see small children, so many people, they will never eat banana. Suppose if you want to give Nishma by putting some other salads or everything, they will remove the banana and they will eat the other things. Next, calcareous car, aversion to water, washing body also, just like sulfur, but not that much, will not do that. But calcareous car, simply they will go for makeup particles instead of going washing and everything. They will use powders, they will use snow, or they will use some oils or like that. So many things are available now, that they will prefer. But they will not go for washing with water. Some tissue papers will be available. Wet tissue papers, with that they will manage calcareous. If any person is like that, male or a female, if he is in jargon, you can remember these people are the persons who will use frequently the wet cloths to clean the face or hands. Those people will come under the calcareous. Next, carbovich, aversion to cabbage. Aversion to cabbage. Sina, aversion to buttermilk. Children, if they are having more warmth and everything, they will not eat this one. Butter they will not take. They will take more sweets. If any mother or father wants to give any butter or any ghee oriented food means, they have to add some sugar and give. Next, conium, aversion to work. Conium people generally not only aversion to work, in the workspace itself they will select sports. Conium people generally in workspace itself, that suppose office or at any area, they will go for a sports type of this thing. They will arrange certain people, they will go sports wise. So aversion to conium, aversion to work, but attracted towards the sports side. Ferment, aversion to eggs. They will not eat omelette or eggs, anything they will not eat. Ferment is one of the good medicine actually, but only because they not work. Only eggs only they won't like other all the things, other things they will like. Very limited things they will take. But ferment is one of the best remedy which creates anemic condition people they can take, creates hemoglobin excellently, and by that way oxygen will be improved in body. Folic acid, very peculiar. We are having same type of medicine sapie also. Aversion to loved ones. Like that, folic acid is aversion to parents, aversion to wife also, that is partner, life partner. Sapia, aversion to family members. Because the reason is in sapia, nearly up to 40-45 years they have worked for the same husband and same children. They are neglecting at the age of that time. Because of that one, sapia aversion will come after nearer to menopause. But acid flow, generally they will averse everything. Fluoric, for that only, these unhealthy persons, fluoric acid excellently to work. Fluoric acid, aversion to parents and wife. They don't like anybody. Next, bromine, same, aversion to own persons. Graphitis, in the beginning I told music, aversion to music, aconite. Like that, graphite is also aversion to music. There, in aconite, what Bodic has told means, aversion creates sadness. Vex, they become vexed if you don't stop that music. In our Aconite people, they will be vexed, whereas graphite is, they will weep. If you don't control the volume of the music, they will weep also. Hydrophobia. I think you know hydrophobia is otherwise called as lysine. This medicine is prepared from anybody knows? Or MPHA people, hydrophobia or lysine. They are aversion to water, but preferably running water. This is prepared from the mad dog. Is it correct? Okay, verify afterwards. Hydrophobia, aversion to water, that to running water. Ignatia, aversion to amusements. And tobacco smoke they can't tolerate. Ignatia people, if anybody smokes also directly they will tell, please stop the smoking. So that is Ignatia. Calibre, aversion to meat. Lycopodium, aversion to coffee, or meat also we can tell, aversion to coffee. But coffee they will take. After taking the coffee, they will feel uneasy. Lycopodium people, because of the dashing mentality, if the people are there, when coffee offered means they will tell I don't want coffee. Suppose forcibly if anybody offers means they will take. Because they need company more. Company is the most important. People are most important. He is a dashing personality, Lycopodium. So he will take the coffee, he suffers. For that again we will go for some other medicine to control it. Lycopodium, aversion to coffee. Magnesium carb, aversion to vegetables. Magnesium carb, please remember our children, so many people, they will not touch vegetables. They will always want Tiffin or some pickles or something like that, spicy food, but they will not touch the vegetables. For those people, magnesium carb for 3 to 4 days single dose, or in 30 single dose or twice a dose, 3 to 5 days it will slowly it will rectify. Like that after 15 days or 20 days again you can give. Magnesium carb will change that one. So for children generally we will prefer this one. Mexal, aversion to brandy. And natural carb, aversion to milk. If he take milk in any form, he will have diarrhea or dysentery. Natramur, aversion to bread, butter. Naxwamika, aversion to beer only. Other than beer, anything they will take. And Naxwamika people, they will not finish certain item totally. They will touch and eat. Suppose if you keep 10 to 12, 15 items, they will everything they will eat, but not fully. Kachabacha they will eat. So Naxwamika, they like good food and everything, spicy food, but they are aversion to beer. Platinum, same aversion to family members. Even close friends also they will aversion. So platinum people we should not believe. Platinum means platina, same thing. I think our Jairats are most better in platinum. Plumbumate, aversion to work. Same. They do their little work only. Whatever the allotted work is there, that's all they will do. Another thing, plumbumate is one of the best remedy for constipation. Remember that one. Other symptoms tallies, plumbumate morning, afternoon some other bio number 4 or like that, evening Naxwamika, 5 to 10 days if you give, even chronic constipation also, it will slowly constipation will reduce. But how long it will take we don't know, but plumbumate 5 to 10 days is sufficient along with Naxwamika in the night. But in between bio number 4 we have to take. Apart from 4, if you are having a piles means 17 also you have to take. Like that you have to change. Bio-remedies always saturate the area, support that area along with the homeo medicines. So when you excuse me, don't tell me, madam.
Murthy sir, excuse me, Murthy sir, కొంచెం సభకు ఇంపాక్ట్
என்ன மேடம்?
ஒரு ஆடியோ இதான் கொஞ்சம் ஹார்டா கொஞ்சம் குவாலிட்டி
இப்போ கேக்குதா? இப்போ கேக்குதா?
கேக்குது, பட் கொஞ்சம் எக்கோ எஃபெக்டோட ஹார்டா இருக்கிற மாதிரி இருக்கு. ஒன்லி ஃபார் மீ ஆர் அண்டர்ஸ்டாண்டிங்
இருக்கலாம் எல்லாருக்கும். நான் ஏசி ஆஃப் பண்ணிட்டேன், ஏசி மூலியமா கூட வரலாம். ஸோ இப்போ கேட்குது நல்லா.
கேக்குது சார். Some extent, but I was going on analyzing. I only even my own voice also I get it.
No, anyhow I have switched off the AC because AC may give. Closed room AC may give the hollowness while speaking. Even recording.
Echo effect இருக்கு. Echo effect இருக்கு.
Okay.
அது நீங்க ஹார்ன் கூட பேசுறதுனால
ஆமா.
AC போட்டுட்டு நீங்க ஹார்ன் போடுறதுனால அந்த echo effect இருக்கு.
So I totally stopped the AC. Now we will see.
Sorry.
No. இப்போ Plumbermet we have started. Plumbermet it will work for aversion to chronic aversion to what?
நீங்க டோர் க்ளோஸ் பண்ணி வச்சிருக்கீங்களா?
ஆமா.
அந்த டோர் கொஞ்சம் ஓபன் பண்ணிட்டீங்கன்னா அந்த எக்கோ எஃபெக்ட் போயிடும்.
அந்த டோர் ஓபன் பண்ணா பக்கத்து வீட்டுக்காரங்க இருக்கும். நான் I am taking class for you only, not for பக்க next portion கேக்குற மாதிரி இருக்காது இல்லையா?
Okay.
அதுக்காக அவுட் சைடு இருக்கு. நீங்க all are flats only na. Okay. Okay.
Thank you.
So Plumbermet is aversion to work. The person will not do the maximum work. He will do the limited work, allotted work, and it is one of the best remedy for constipation. Along with that, what I told, constipation morning for constipation morning Plumbermet you give in 30 potency. Bio number 4 in the afternoon you have to give. Right, Laxvamika like that, or 10 to 15 days if you give, it will streamline the constipation in this one. The chronic constipation slowly come down. Next, radium bromatum, aversion to ice creams. Generally, we will not use this medicine. Don't take this one because it has given the books I have told. Raphanus, Sabadilla, aversion to cold water. Suppose if the person has taken any cold water, either internally or taking bath also, that person will get sneezing continuously. So Sabadilla is the most important. Sapia, previously I told aversion to family members. Silesia, aversion to mother's milk. This man wants only what we call external powder milk. Silesia, if you give that one powder milk, he will stop and he will take mother's milk. In the early stage, in the beginning, Natrum Phos and Silesia are the best medicines for children, months babies. Next, sulfur, aversion to be washed. So he will not go to washroom for taking bath. He is aversion to that one. With this, my aversion thing has been gone. So, Suresh Kumar, sir, you can take the class.
Yes, sir. Is audible to everyone?
Yes, sir. Yes.
We are able to hear.
Yes.
Okay.
The good sir, I am leaving really. I am leaving.
Okay, sir. Thank you, sir. Thank you.
And very warm good evening to all members, the participating members here. And all of you must have received my therapeutic dose. 6 parts I have circulated. Last part was 6th part was also circulated to you. I don't know how many of you have opened and gone through the contents of that, but I will advise you, all of you take a printout of it, keep it on your desk, and it will be a sort of manual, or else it will be a sort of guide to your clinical practice, so that will be handy to you in your day-to-day practice. So that is, and give me feedback, that is more also important, how far it is effective to your clinical practices also. That is more important. Any addition, deletions, etc. that also can be done, but after verification, confirmation from various sources, we will do it. That also, updation of the contents also is possible, and your suggestions are also welcome. Going to this series, one of our participating member has asked me sir, you are not included in this about glaucoma. He said, you are not included into this disease and not given the therapeutics also. Then, I thought that we'll take up this topic little extensive, then we'll go to homeopathic therapeutics also for this. So glaucoma is, all of us know, or it is refers to involving an eye pressure increase that leads to permanent vision loss or even blindness also. So it can be a partial vision loss leading to permanent vision loss also. This condition can happen for many reasons, but mostly the majority are the treatable. Knowing the risk factor and getting regular eye examinations, it may help avoid such type of discomforts or vision loss also. Coming to what is glaucoma? Glaucoma is an umbrella term for eye disease that makes pressure build up inside your eyeball, which can damage delicate and critical parts of the eye. Most of the disease is progressive, which means gradually they worsen down. As they do, they can eventually cause permanent vision loss and blindness. In fact, glaucoma is the second leading cause for blindness worldwide. Learning that glaucoma or that you are having a risk, it can be hard to process. For most people, vision is the sense that they lie most in their daily routine. It can feel scary to imagine trying to adapt and to live your life after you have a severe vision loss. But most forms of the glaucoma are treatable, especially when diagnosed early. And with the care and careful management, it is also possible to delay the progress of the disease and even prevent the loss of vision also. So, only thing that we need to take adequate care, early diagnosis also. The symptoms involved in glaucoma. What are the symptoms in glaucoma? In early stages, though, glaucoma may not cause very large type of discomforts or it may not present also initial symptoms also. That's how they, half of the people in younger stage and happen like this, and glaucoma is not known to them and is visualized later part of their disease progress. And symptoms do not appear until and unless it causes irreversible damages. So when the irreversible damages are initiated, then only in this disease the symptoms start projecting extrovertedly. So some of the common glaucoma symptoms are early eye pain on account of internal pressure in the eye. Eye pain may be there may be headaches, and there may be redness of the eye, there may be double vision diplopia, there may be blurred vision, and there may be also even gradually lowering of your vision discomforts, so gradually increasing, and loss of vision may be apprehended in progressive. And even you may also have a blind spots and also visual defects like tunnel vision also. The tunnel vision sort of appearance can be felt in eye, and blind spots also can be visualized. So these are the some of the important symptoms on development of this glaucoma. particularly when then I will discuss with the type of the glaucoma also, but particularly one type which is angle closure glaucoma is can cause sudden and severe symptoms and need immediate medical attention and prevent so that the permanent vision loss can be prevented or checked. So emergency glaucoma symptoms are, in this emergency for this angle closure glaucoma can happen when blood clotting in front of your iris is apprehended, that is called hyphema, and bulging of enlarged eyeballs. When bulging of enlarged eyeballs are being apprehended, when there is a nausea and vomiting with eye pain and pressure, and then when there is a sudden appearance and increase in floaters, there will be different type of floaters in the eye, and there will be sudden appearance of floaters in the eye, and there is a sudden vision loss of any type of suddenness and vision loss, and there is a sudden flashing of lights in the vision. So these are the emergency glaucoma symptoms. I repeat, blood gathering in the front of the iris, bulging in the eyeballs, nausea and vomiting with eye pressure and eye pain, and yeah, one more thing, rainbow colored halos around the eyes. If you see rainbow colored halos around the eyes, then it is also any emergency glaucoma symptoms. So sudden appearance of increase in floaters and sudden vision loss, and suddenly seeing some flashing light in your vision. So these are some of the emergency symptoms which need to be attended in glaucoma. Then what causes glaucoma? The primary cause of the glaucoma is optic nerve damage. Okay, it can occur without any cause, but many factors can affect condition. The most important of these risk factors is intraocular eye pressure. Main reason for this is IOP, intraocular eye pressure. So our eye produces a fluid called aqueous humor that nourishes them. This liquid flows through your pupil in front of the eye. In the healthy eye, the fluid is drained through mesh-like canals, which is where your iris and cornea come together. When iris and cornea come together, at that place there is a mesh-like work is there, and through that angle, this fluid is drained up. But with glaucoma, the resistance is increases in the drainage canals. Basically, the pressure is built up in the drainage canal, and fluid has nowhere to go, and it builds up a pressure in the internal eye, and the excess fluid which is gathered inside, they put pressure on the eye. Eventually, the elevated eye pressure damages the optic nerve, and ultimately they lead to glaucoma. So in nutshell, we can say that the drainage system is weakened down, and the fluid is retained inside the eye, and subsequently the eye pressure is built up, intraocular pressure is built up, and intraocular pressure damages the optic nerves. So with this, this is how the glaucoma is developed, and I have given the causative factor for the etiology of the glaucoma. And there are types of glaucoma. I will briefly go through this, because I will ask Dr. Anup to have a that is called video presentation of this types of glaucoma. But I will explain now. The primary glaucoma is called open angle glaucoma. The first variety is known as open angle glaucoma. Open angle means the drainage angle where inside the sclera and the outer edge of the iris that meets is open wide, and aqueous humor flows through this draining angle, so that drained out to the anterior chamber. This is the most common type of the glaucoma. So open angle glaucoma is a common type of glaucoma. Then the second variety is called angle closure glaucoma or closed angle glaucoma. So aqueous luminal fluid is supposed to flow from posterior chamber behind your iris through the pupil into the anterior chamber. But sometimes the lens of the eye presses too forward, blocking fluid flowing through the pupil opening. The extra fluid in the posterior chamber forces iris forward, narrowing and closing the draining angle. This is a closed angle glaucoma. So I have given the causality factor. We will explain you through video presentation that more clarity will be. But now for the notes point of view, I have given that the open angle glaucoma is one variety and the closed angle glaucoma is another variety. There is another secondary glaucoma is also visualized. This is third variety, when other conditions or other event increases the eye pressure, which leads to glaucoma. That is particularly eye injuries, then pigmentation dispersions, and certain medicinal influences like corticosteroids and cyclopletics. These are the medicine which causes the secondary glaucoma. And then sometimes congenital glaucoma is also visualized. That is rarely seen, but that happens during the fetal development itself, and that will limit because congenital glaucoma is an inherited one. So basically the two varieties are common: open angle and closed angle glaucoma. And secondary glaucoma is because of the other conditions, injuries, etc., etc. So these are some of the variety. And what are the risk factors in glaucoma? What are the risk factors in glaucoma? The most risk factors, first, age. Age is one of the factors which also becomes a potential reason for the victimization into this type of disease. Most type of the glaucoma affects people older age, particularly above 40, and above 40 is more prone to this type of complications. Experts estimate that 10% of the people aged above 70 and 75, they are also having a glaucoma. 10% of the age 70 and 75 are older are subjected to glaucoma. Then race. The other risk factor is race. It is scientifically it's been observed that black people have a much risk in developing primary, that is open angle glaucoma, especially in Afro-Caribbean places, and people of African descent are 15 times more likely to have blindness from open angle glaucoma. Then people of Asian and these regions have a higher of closer angle glaucoma. So then coming to sex, women are at a higher risk of close angle glaucoma. So this is another risk factor. So women have a risk of a close angle glaucoma. Then refractive error. We have two types of refractive errors: myopia and hypermyopia. So nearsightedness, myopia has got a high risk of open angle glaucoma, whereas farsightedness, hypermetropia have a high risk of close angle glaucoma. Then family history, there may be family history of glaucoma to the particular biological relatives, parents, child, siblings, and this is also one of the risk factors. And chronic conditions, researchers have come to the findings that high blood pressure leads to glaucoma, and that may be another underlying causative factor for the glaucoma. And diabetes also is a much risk provider to this development of the progressive development of the glaucoma. I have few patients, some of my office colleagues also, I have found that these people having a diabetic background. Two of the three patients have a diabetic background and one patient having a hypertension. So definitely this chronic conditions, hypertension and diabetes have a greater risk for a progress of the disease. So these are the risk factors: age, race, sex, and refractory errors, family history, and chronic conditions like diabetes and blood pressure. So these may be the risk factor. And how glaucoma is diagnosed. The diagnosis for this, or otherwise I will come to brief glaucoma test. What are the glaucoma tests? Includes visual acuity test, visual field test, depth perception test, then tonometry test, then slit lamp examination, and gonioscopy. So, and then pachymetry. These are some of the tests through which we will be able to monitor, diagnose the disease. I repeat, glaucoma test includes visual acuity test, visual field test, depth perception test, then tonometry, pachymetry, slit lamp examination, and gonioscopy. These are the various tests recommended for glaucoma disease. So I have given the brief input about what are the etiology, what are the risk factors, what are the types of the glaucoma, and with this we'll go into homeopathic side, because we are more interested. Many people will say that one of our friends, when he was referring to me, that he said that homeopathy has got a very little antidote for this. I will definitely say no, because my answer will be no, because homeopathy has got a many medicine. The moment this disease is diagnosed, if they come to us, definitely we can help them and check them the progress of the disease. At least we can stop the damages to the retina. So we can check the damage to the retina. So that much we can help the patient. So at least we can reduce the pressure of the eye, intraocular pressure also. So these are possible in homeopathy, not in allopathy. So I have seen patients coming to me going to Shankar Netralaya, going to Rajan Eye Care and different eye cares, etc. And ultimately they are lost their visions, or they have a diminished vision and they are suffering. So for this reason, if they come early to us, definitely the homeopathy becomes a rescue to them. The prime remedy, I will list down the prime remedies and then some of the rare remedies also I will give. And phosphorus is one of the finest remedy for this. Many times phosphorus is a respiratory tract remedy, but not only this, for eye phosphorus is immensely useful for this glaucoma. The next important remedy is our belladonna. Let's not forget the belladonna. Belladonna is a very good remedy for correcting the circulation and circulation in the eye arteries or internal arteries of the eye also. So that thereby it can reduce intraocular pressure. So belladonna can be very handy. Then let's not forget our good friend Physostigma. Physostigma is one of the potent remedy in giving relief in glaucoma. Then let's not forget that's called Spigelia. Spigelia has got a very good remedy in this condition for glaucoma, because I have a clinical research paper with me where Dr. Shah has given me, I noted down Dr. Shah's research paper where he used Spigelia over 6 months and reduced the intraocular pressure from 26 mm to 18 mm. the provings are there, and that's why I can evidently say that Spigelia works very well for reducing the intraocular pressure. So hats off to Dr. Shah for giving us this paper for the students. So Spigelia works very well, and let's not forget another remedy, Gluconide. Gluconide is also reduces the intraocular pressure. Let's not forget that. So these are some of the prime remedies: phosphorus, belladonna, physostigma, Spigelia, Gluconide, and let's not forget the gelsemium also. Gelsemium also is very handy. Apart from this, Ruta. Ruta is also very handy in glaucoma. So I have given the front line remedies: phosphorus, belladonna, physostigma, what's called Spigelia, Gluconide, gelsemium, and Ruta also. Coming to next important remedies in our army. Chromocladia is a rarely used remedy. Chromocladia is one of the best remedies recommended by many masters. Osmium. Osmium is also rarely used, but it works fantastically well for the given condition. Then another very rarely used remedy is Prunus spinosa. It is also an important remedy for bringing cure in glaucoma. So I can definitely say the second line of defense is Chromocladia, Osmium, and Prunus spinosa. Then let's not forget Cedron. Cedron is another remedy which can be thought of in this given condition. And Conium. Conium is, I forgot to tell, in the first line of defense remedy. Let's add Conium also in the first line of defense remedies. Then coming to, when I was talking the second line of remedies, let's not forget Atentum Lignum, Calcarea Flow, Cali Iode, and Digitalis. Digitalis is also one of the remedies, though it is predominantly is a heart remedy, but it also reduces the intraocular pressure. There is a research paper to this, and American research paper to this. Digitalis have a good effect in reducing intraocular pressure. So I have given the second line of defense remedies. Then coming to some of the other remedies, like recently under very rare remedy, Ginkgo biloba. Ginkgo biloba is one of the rare remedies. Recently masters have advocated for this. It is also used for other ailments. Ginkgo biloba is a vasodilatory, is an anti-inflammatory, it has got antioxidant properties also. And these all three factors lead to increase in retinal and choroidal circulation and reduces the free radical in the eye. And that's why it is a neuroprotective. It has got a neuroprotective effect, and it slows the progress of the glaucoma. So Ginkgo biloba is also effective in reducing or checking the progress of the disease. And then next is another rare remedy is Sorothanus scorpionatus. I'll give the notes also for them. It is Sorothanus scorpionatus. So this is another remedy. This is spelling is SAROTHANUS Scopanarius. SCOPANARIUS. So this is another rarely used remedy indicated for glaucoma. Then another rare remedy is Iserinum. It is different from Inserum. Please don't confuse it. Inserum is a prime remedy for kidney disorders. So it is Iserinum. ESERIUNUM. Iserinum. And it is to be given 6x potency. Very, very specific. Iserinum 6x is very effective in checking the progress of the glaucoma. So this is also a rare remedy. Then another rare remedy is Lesinum barbarum. Lesinum barbarum is called also wolfberry. Wolfberry is a type of berry. The botanical name of this or medicine name is Lesinum barbarum. And it is also it has got this wolfberry has got a neuroprotective effect, and it protects the degeneration of retinal ganglion cells. This wolfberry has got impact on the retinal ganglion cell. So it protects the degeneration of this. So this is also can be used in case of glaucoma. And then bilberry is another berry. Bilberry is another. It has also got a neuroprotective effect, and it is also has got a it stops the degeneration of retinal ganglion cell. Both woodberry and bilberry both are effective in protecting the damage to the retinal ganglion cells. So that's how we can protect the retina, damage to retinal nerve. So this is an alternative method. What I am discussing now, bilberry and wolfberry is an alternative method of protecting through this. And then coming to vitamins, vitamin A, vitamin B9, vitamin B12, vitamin C and vitamin E. All the four are very essential in protecting the nerve damage in case of glaucoma. I repeat, vitamin A, B9, B12 and vitamin C and E. Then alternative methods. So neuroprotective measure, alternative measures is you have to use dark leafy vegetables where higher amount of nitric oxide is present. When you have to use in our input dark leafy greens where nitric oxide is large in quantity. Then omega 3s. We have to use omega 3s. Also there are capsules nowadays, omega 3. Then we have to use melatonin, and we have to use bioflavonoids, and we have to use curcumin. Let's not forget curcumin, turmeric. Curcumin is turmeric is very effective in protecting eye damage. And then green tea. The use of green tea also protects build-up of intraocular pressure of the lens. So these are some of the alternatives I also have suggested apart from vitamins and other neuroprotective measures. So I have discussed now the entire homeopathic approach. First line of medicine, second line of medicine, then I have given rare medicine, uncommon medicine also I have given. Apart from that, alternative measures, vitamin support and everything I have given you brief. Okay, over to this I give pause to my talk and over to Dr. Murthy.
So only one word. Actually the optical pressure supposed to be, for example, 12 water will be. After doing this surgery, the doctor advises to continue the drops or some little tablets also. It can be very improvement of
Yes, pardon me, can you repeat the question?
Actually, what will be the optical pressure, sir? Normal pressure.
No, I'm not talking about a surgical part of it, because the post surgery involves lot of issues involved. If time permits, next time I will go into that also, post surgical measures also. But today I have briefed myself non-surgical approach initially, because before going to the surgery or before before the magnification of disease, very initially when we enter or treat the disease, before it produces the vision damage or the blindness, we can definitely take the progress of disease and we can take the degeneration process.
Actually, one of my colleague only went for eye testing and all, the doctor was telling because for the money was there, I attempted. The doctor said that he has to take continuous glaucoma medicine till the end, like that. Again, somebody was suggested because of some nutrient displacement or something. You start asking him to come and asking him from the block they are giving and he has to continue like that. That is why I asked.
I am not coming papers, research papers of doctors, homeopathic doctors handling case of I am not coming across so far post-surgical interventions for homeopathy glaucoma, but definitely I will explore this possibility and come back to you with conclusive evidence. because without the proper evidential fact, I don't want to give my conclusion at this juncture, because I definitely will try to go to some of the papers or documents, references and documentations at the international level also, where whether the homeopathy is really beneficial in post-surgical scenario. So, okay.
Thank you, sir. Today's class also I understood a lot from your field. That is why this small note I want to pass them. So thank you.
Doubts are has to be definitely, and that doubts should be there. That's what, when doubts are there, then on to faculty will have a work. We have to have homework. So if you give homework, we will do it. Okay. Over to Dr. Modi.
Okay, sir. I think time is up. We'll close the session. Thank you very much. Next week we'll meet, sir. Thank you, sir.
Thank you, sir. Thank you.